I was 34 weeks pregnant with Cassie. That day I had gone into work. It was a normal day. I had my OB appointment. I had started having some pain, and so I told my OB, and when she checked me I was dilating, so she sent me down to the main hospital. I got there to the hospital. Everything with Cassie's vitals looked good. I was still having a lot of pain, and I had started contracting a little bit, so they were getting worried. And then when I was going to be discharged, I had just shooting pain, horrible pain in my lower back, and the doctor that was there said, you know what, we're admitting you. We can't send you home like this, and they decided that they were going to induce labor with Cassie. It was a really easy delivery. She came out crying. She was doing really well, and I got to hold her for a couple seconds while my husband took a picture before they took her to the NICU. I had family coming to visit. My sister and brother-in-law brought my son Ashton. We walked him down to visit Cassie, and he got to go give her a stuffed animal and see her in the incubation holder where she was. I left Ashton with Josh in my room where I was, and I walked my brother down to meet Cassie. We just walked in the door, and I had this shooting pain, and I collapsed.
Because of the nature of her pain, it really seemed like she had a serious problem in her abdomen. And from my perspective, she needed to be seen by an obstetrician as soon as possible. So fortunately, we're very close to the obstetric deck, and I just simply walked 20, 30 feet from our unit, which is where the deck is, and talked to the doctor on call, Dr. Lisa Brown, and told her about the mother and asked her if she would see her.
And I remember them just coming and running and surrounding me, and one of those doctors was Dr. Brown, who I had previously never met. She helped me onto a hospital bed, and then I was gone, and I remember feeling myself going, and I said, I think I'm passing out.
While I was starting to talk to Dianna, one of the NICU nurses had opened Health Connect so we could look at her chart, and although I could tell that Dianna was in a lot of pain, it just didn't add up. She had had a normal delivery. There were no complications, the sorts of things that you think about as an obstetrician in postpartum pain in someone who's had a normal vaginal delivery. So we got her into a room, we called a code blue, so we had a lot of help very quickly. She regained consciousness, but her vital signs showed us that she was unstable clinically. We obtained an emergent ultrasound of her abdomen, and it showed that there was blood in the abdomen.
Every specialist was there in the operating room to make sure that whatever was wrong inside, the right specialist would be there to operate. Dr. Plecha was there, and that was the first time I met him, and he was going to be my vascular surgeon, and he just let me know, you're bleeding a lot, and we don't know why, so we're going to have to do an exploratory surgery. And I was terrified, and Dr. Brown was still there in that room, and I remember her calming me down and just letting me know it was going to be okay.
We're ready to open her abdomen when anesthesia was induced, and we immediately encountered a large amount of blood within the abdominal cavity, and proceeded to explore her abdomen. We found that her uterus wasn't bleeding, and that her solid organs, her liver and her spleen, were also not bleeding. And so we were concerned that she might have a visceral aneurysm, or an aneurysm of one of the arteries that go to the organs in the abdomen. And we proceeded to explore and found an area where we thought she was bleeding that was behind the pancreas. And this can be a very difficult area to expose and to explore. And fortunately, we're able to ligate it and control the bleeding.
I woke up in the ICU and there were several doctors there and my family were there, and I was just totally confused. I had tubes everywhere and I didn't know what was going on. My doctors came to see me. Dr. Brown was one of the first doctors that came in, Dr. Plecha, and they just kind of, I couldn't talk because I still had a tube down my throat, but they just kind of explained, you know, that I'm okay now, but I had an aneurysm in my abdomen and it ruptured. The initial pain the day before, I guess, was this aneurysm growing and leaking. Somehow I was able to get through delivering Cassie with this aneurysm ballooning and leaking. If any of those scenarios, if any of, you know, the time frame had been different, if I had been discharged, if I had gone home, if I hadn't been sent down to the hospital to check out what was wrong, I would have died, and Cassie would have died.
I think that Dr. Sweet very possibly saved Dianna's life. The reason being was that with a ruptured aneurysm, time is of the absolute essence. That there are minutes before a patient will be in such critical condition that their vital organs will stop, their heart will stop. So I credit Dr. Sweet with setting off the chain of events that saved her life.
That was probably one of the most rewarding cases of my career, when you can help a young, vibrant woman, a new mother who has her whole life ahead of her, to get to see that life. That's what we go into medicine for.
She's a little spunky ball of energy. She's just a fighter, and she will, I think that's just in her personality now. She's just such a beautiful person and so loving, and I can't even imagine our lives without her. I mean, she's so special. Ashton is such a good big brother. He's so good with her, and she just thinks he's the best. She really loves him. I think about those people that were there for us all the time. And it's hard to think about the fact that I shouldn't be here and without these people who helped us, these doctors, surgeons, nurses. The fact that my daughter wouldn't be here, and the fact that I wouldn't be here with my family. But really, on a daily basis, I just feel nothing but gratitude for those doctors.